Hey, welcome to Jump Conversations. In this video, I'll be talking to one of the experts in the field of physical therapy, biomechanics, and sports performance. His name is Finn-Tore Camacho Bjørnsand, and he has a lot of knowledge about how to improve and treat the human body. We'll be talking about jump rope benefits, jump rope strength training, injuries, prevention, treatment, and a lot of other interesting topics. I had a lot of fun and I learned a lot talking to Finn-Tore, so I hope you'll also find this conversation interesting. So enjoy, here it is. Welcome to Jump Rope Tips. Today I'm joined by Finn-Tore Camacho Bjørnsand. He's a physiotherapist and an expert at the human body. I'm really pleased to have him here on the show. He's got his own clinic. He's been working for years on performance coaching and all kinds of stuff that we can get into later. And also he's a really important figure in the fitness and health community, always sharing his ideas and really trying to make us all better, which is something I really love about him. And he's one of the Instagram kings when it comes to meme. So, welcome to the show. Nice to see you, Finn.
Thank you so much for the invitation and for the kind words, Kjartan. Much appreciated.
So, how's everything? Are things getting busy, or are you still kind of like halfway shut down with the COVID and everything going on?
Well, we are partially getting back to normal now. People are starting to get back at work. We got new employees. Our customers are finding their way back. So, I would say that we're about maybe 80% of our capacity of how it used to be before COVID.
Cool. You know, I started with this jump rope stuff, really posting stuff online and all that during the COVID. And that's been one of the huge trends, home training and, how to work out outside of the gym.
Yeah.
And especially, jump rope being like accessible for everyone. It's kind of taken off the last year. Have you seen any trends like that from your point of view, like how things have changed for people and working out?
Well, first of all, I just need to say that I think you're doing an amazing job. The way you're presenting jump ropes and the accessibility, how easy it is for people to actually just do something for 1 square meter. So, creds to you. And
Thanks
besides that, yeah, of course, and besides that, I've been seeing a lot of trends from people working out from their comfort of their own home. And I think there's a lot of lack of variety. So a lot of people probably are losing their motivation after a little while. So, and not being able to do a proper cardio workout. So I think jump rope might be a really good option for them.
Yeah, especially when the gyms were closed. That was a lifesaver for me.
Yeah.
So let's talk a little bit about you first. I figure we can let people get to know you, your background, to kind of understand where you're coming from with your point of view on how we all should use our bodies or whatever. And then we move into more jump rope specifics. Does that sound okay?
Of course.
I think you would be the best person to explain your job and your area of expertise. I know you're a physiotherapist. I know you're a performance coach and also a sports psychology type of coach, if I don't have it all wrong. And I know you also have your own clinic.
Yes.
So how does that work for you? Yeah. What kind of people do you work with, and how do you help people, and how does your clinic work?
Well, first of all, I think I have always had a vision, the way I look at people, because for me, it's not only looking at people from the head and down. So when I was studying, I was first studying sports science before I did physiotherapy. So I wanted to learn the training physiology. I wanted to learn, what we can do with exercise, how our body adapts, muscle train, the muscle physiology, how strength training, cardiovascular training, everything that has to do with the activity. And then I studied my bachelor in physiotherapy. I did my master's in athletic therapy, and I had done my clinical doctorate degree in manual therapy. So I like to specialize within what has to do with their body. and musculoskeletal, joint and muscle issues. And I started actually this year studying. I did a degree in certified sports and psychology, and now I'm studying sport and exercise nutrition. So I
Cool.
really love, everything that has to do with the body, and I don't like to isolate one element from the other. So exercise, biomechanics, mental energy, nutrition, sleep and recovery, general health, everything is interconnected. So when people come to our clinic, we're not just only seeing them for the lower back pain or the knee issues. We try to, what can we do to make people perform better, to feel better emotionally, psychology wise, and emotional with certain exercises for both our mental health and also our body, and also looking into implementing strategies for sleep recovery and nutrition. So we try
Yeah,
to be
the whole
evidence
package.
based. Yeah. So our main goal is to be a holistic, evidence based clinic within our space.
Cool. And would you say most of the people that you work with personally are kind of like athletes or people looking for performance, or like everyday people trying to prehab or rehab for injuries?
Well, I think it's a really good balance between the professional athlete and the recreational athlete. People who has family and kids and who work out a lot, and we also have people who don't train at all that needs to get little extra motivation from us. So I think it's a fine balance between those two, and I love having both the aspects of the human body.
Yeah, and I know you're a goalkeeper, you play football, and you're also coaching a team, is that right?
Well, when I was younger, my dream was to become a professional football player, and when that didn't happen, I just focused on my studies. I started doing more strength training. I wanted to look like Dwayne the Rock Johnson or Arnold Schwarzenegger.
Don't we
So
all?
and now lately yeah, and now lately I've been missing playing football. So I'm training some goalkeepers, and I'm playing at the second team myself, just recreational football.
Cool, cool. And what about you or any of your clients? Are any of them touching a jump rope at all, or is that kind of like not really part of your world?
Well, I'm glad you asked because I think jump rope has so many aspects to it. It's not only limited to the boxer or the professional athlete, as many people might associate it with. I do have a lot of people who has had tendinopathy of the Achilles tendon or partial rupture or complete rupture, and runners, professional runners. So I try to implement some jump ropes as a part of the rehabilitation and also the strength and conditioning program. So I
Cool.
think it has many variables we can use there. And I do have a lot of CrossFitters. They do the double unders and they do
Yeah,
a
yeah.
lot of roping. So
Hmm.
it definitely has
Yeah,
a space with it's important.
cool, cool. So yeah, let's get more into detail on that. And for those confused, jump rope and skip rope are the same. From what I understand, jump rope is the American version and skip rope is the British version. So, those two terms are really interchangeable, but, me having spent a couple of years in the States when I was younger, I'm more of the American language type of guy, so I always call it jump rope. But I know a lot of people call it skipping or skipping rope, but yeah, for those confused, that's the same thing.
Yeah, and I'm glad you mentioned that because when you search in the literature, sometimes it says skip rope, sometimes it says jump rope, but that's what makes it difficult for people who wants to be evidence based. That in the research they use different terminologies.
Yeah, that's a good point. And also, of course, you have this long jump rope too. That you have two people swinging it, and like you form a line or whatever. I don't know the professional term for that, but in
Uh,
I guess that's also kind of part of the whole jump rope world. But for now, let's talk on the one-on-one type of jumping. Um,
sure.
so, yeah. So I have some notes here. So if I'm looking down, it's just like to remember some of my questions. So let's talk about why we should jump rope. The way I see it, first of all, the main reason to pick any type of exercise is because it appeals to you. It's because it's fun. That's the main reason to pick boxing, football, jump rope, or whatever. If it's fun, you'll keep coming back, you'll want to improve, and all of that. So really, that's the main reason, as far as I see it, to pick any workout type. But having said that, not everyone likes the same thing, and some people are more goal-oriented than others. So like, if you want to just look specifically at why you should jump rope, obviously it's time efficient, and it's a really effective high intensity interval training, HIIT.
Yeah.
So I guess it's kind of like a replacement or supplement to running or whatever type of cardio work people might do. But that's me looking as an average Joe or whatever. What would you say are like the main reasons why someone should pick up a jump rope and start using it?
Well, I think first of all, the accessibility. You don't need a lot of space, and I work with a lot of professionals within consultants, lawyers, people who travel a lot with work, and sometimes they're not, because of the flights and because of the airports and the different hours from one country to another, they're not always able to hit the gym, right? So I tell them, bring a jump rope with you, because you can do, as you mentioned, high intensity interval training, or you can also do, a slow state cardio with the jump rope, just the pace you're using. So the accessibility, and if you're, like motivation, if you like something, that might fluctuate from one day to another, right? So one day you might feel really motivated, but discipline, if you are disciplined, you will do it every day a little bit, or every other day. So I try to tell people, it has to be an exercise for your brain to do the jump rope every day a little bit, especially if you're traveling and you're not having access to a gym. It takes you 10, 15, 20 minutes with push-ups, sit-ups, jump ropes, sit-ups. You can train your whole body, both strength training and cardiovascular exercises, and at the comfort of your own hotel. You don't need a big room to do that. So discipline. So discipline, cardiovascular workout if you want to do the high intensity or the slow state, and also the strength training, because you can do doubles and you can jump more between and do interval training with push-ups, sit-ups, and maybe some squat jumps, and train your whole body. So I think it's an excellent way, and I think, there's a lot of philosophy within our world, of strength and conditioning. And one of the principles we say is that before you start lifting weights, you should be able to lift your own body. So starting with own body weight, being able to control lifting that might be a very smart way of starting.
Right. Yeah. Of course, the accessibility and also the low threshold. I mean, even if you get like the top level jump rope, it's still like $50. It's still a very low investment. So yeah, the accessibility and the price obviously are, and the ease of travel. True. I totally agree with you on that.
Yeah.
And you also mentioned something about the Achilles tendonitis and the rehab. How does that work? How does the jump rope come into that?
Well, I work with a lot of professional athletes and recreational athletes. And what we see is that there's different phases in rehab. There's 4 main stages. And, of course, in stage 1, when things are really inflamed, painful, and you have a swollen Achilles tendon or a knee or a hip, you do not want to load it too much. But in a later stage, you want to get back to the sport, the return to sport phase. And one of the things that I use also with ACL reconstruction of the anterior cruciate ligament, the knee patients that I see, I do skip rope, jump ropes as a part of the rehab program. So I think it has its room or space in both the rehab and also the return to play. And so that's one thing. And the second thing is that every time I have a professional athlete with either they have injuries or they want to perform better, I try to look at what the sport requires, right? And I see the athlete in front of me. I see what strength do you have and what weaknesses do you have. And really often I see that the strength in their plantar flexion in their foot it might be a bit too weak. It might be a little bit too slow. So trying to strengthen, the whole kinetic chain from the ankle to the knee to the hip, having a straight line, being strong, jump rope would be an excellent way to implement that into your workouts. And that might help you with your running, your jumping, your lateral shifts, having a stronger foundation.
Yeah, that's really interesting, man. And it's cool how you also mentioned the lateral shift because, I mean, traditionally a lot of people do jump rope up and down, right? But I talk about in some of my videos how you should work in all three dimensions, side to side, back and forth, crossing your feet and all that. And that's also like some people forget you can do that with the jump rope to work on the stabilization, change of direction, and all of that. So that's really cool that you mentioned it too.
Yeah, I definitely love it. I think there's the only limit we have to it is, people's imagination. And I think people can just go into your YouTube channel and just find inspiration for different workouts. I think you have a lot of nice videos there, and it makes perfectly sense to get some inspiration from your videos.
Yeah, thanks, and likewise. And by the way, in the comment section or description of this video, I'll also post links to all of your channels. I mean, I even forgot to mention Finn-Tore has 3 multi-language podcasts that you have to check out. There's a lot of information. And for his Instagram and all that, make sure you check the description of the video. All right. So
thank you so much.
We talked about who should jump and why. Now, some people probably shouldn't jump. You mentioned the first stage of the rehab phase, stay off the jumping. Maybe also some other people, like, for example, really sedentary or really overweight people, or who should be very careful when it comes to jumping rope and maybe not do it at all or just very little.
Well, I think the only setback that I would say, or people that I wouldn't recommend it to, would be the ones in phase 1 and 2 of rehab. If you're sedentary, overweight, I think you should jump rope because you can start very easy, and it's really easy to measure your progress. Are you able to do 1 minute straight? Probably not, but you can have it as a goal, and then you can do 90 seconds, 2 minutes. It's easy to have a progression. And remember, if you're overweight, if you're sedentary and you don't have developed those muscles, remember 2 things. Number 1, it will be painful, but pain is not the same as injury. So you might have something called DOMS, delayed onset muscle soreness. So you will be painful, you will be stiff, you might get some aches and pain, but that's not the same as injury. So if you start jump roping and you get the pain, expect it. Number 2, the body is a microorganism and the body will adapt to the load you put it through, right? So giving the body proper stimuli to get stronger and doing a little bit every day, it's super, super smart. It's a really good way of starting, and you will get your self-esteem up because you're doing something with your discipline, you're doing something for your mental health, you're challenging yourself, and you're doing something for your physical health. So I think it's an excellent way of getting people moving, and I don't think anybody, unless you have an injury, like a severe injury, phase 1, you shouldn't. But if you have an injury, but you're not phase 1 or phase 2, you should be doing something. You should load your body. You should push yourself. Don't be afraid. It's normal to have some aches and pain.
Okay, that's great. So do you have like a rule of thumb? What's an injury and what's just a regular ache or pain? How does the average person know that? Like, I need to be careful now, I should ease up on my jumping, or this is just a normal part of the early phases? How do you know what's like a serious injury?
Well, there's certain characteristics we can look for. Like number one, swelling, right? If it's really swollen, it's visible.
Okay.
Swollen. Okay. If it's red, you should be careful. If it's really, really painful just walking, it's probably been a little bit too much. If it's more painful than 3 to 4 days, you might want to relax a little bit. But besides that, it's probably you just delayed onset muscle soreness. And
Right.
remember, that Achilles tendon is not vascular in the same way as the muscle is, so it might take a little bit longer time for the collagen regeneration than the muscle regeneration. So collagen synthesis and protein synthesis. The muscle will grow a bit quicker than the tendon. So
So
don't worry about that.
so for practical reasons, does that mean you need more rest time between the sessions to like grow that collagen, or like how do we apply that to like something practical that knowledge?
Both yes and no, because we know that the optimal loading for regeneration of the optimal regeneration for collagen fiber is optimal loading in the line of stress. So actually doing a little bit lighter, lower load of the same plantar flexion would be the recommended exercises. So
Okay.
I wouldn't worry about repeating a little bit every day. Maybe not jump roping every day if it's really painful and swollen, but maybe do the movement. Get up on your toes, slowly down, up and down. Try to push yourself a little bit within what's the normal pain threshold.
Yeah, I like it, man. I mean, I listen to a lot of like, David Goggins and those really out there extreme type of people who
Yeah,
always tell you to push through the pain. But it's good to hear also like a physical therapist saying that, yeah, you can push through the pain. It's safe and it's normally okay. That's good
yeah.
to
And
hear.
let me just say that I love David Goggins. I think he's amazing, but he has had a lot of injuries unnecessarily.
Of course.
So
Yeah, yeah. I mean,
yeah.
we're not
So
there.
but
I mean, most of us are not there quite yet, and we don't even have half of his mental toughness. But yeah, from what you're saying, we could all push ourselves a little bit harder. That's good.
yeah, definitely.
All right, so let's get into some more jump rope specific and the biomechanics. Me, for example, unless there's something special going on, I jump rope at least a few times a week, right? Some sessions are just for
Hmm.
fun, and some are more performance oriented, like you're talking about with the CrossFit people doing the double unders. I might do a speed test, see how many I can do in 30 seconds. There's different ways of measuring your performance, but sometimes we want to improve that. Or, like you talked about before, we want to keep on going on for longer at the same pace. So, what would be like specific exercises or muscles we should train in order to like boost that performance? Either boost the speed or the endurance or whatever. Besides jumping rope,
I think we
obviously.
can do. Yeah, no. Well, I think it's important to think about. There's two different physical capacities we're looking for. Number one, we're trying to build strength, and number two, we're trying to build endurance, right? So
Yep.
doing exercises that are like the calf raises, doing lunges, doing side bridges for your core. I think that might be the three that comes to my mind right away. And
Cool.
of course, doing some cycling, doing some cardiovascular to build the lungs and the cardiovascular system that you need to be able to sustain a workout. That would be a combination if you want to do it isolated both ways. But again, I think doing jump ropes, you get both the best from both worlds at once.
And what about rep ranges? Like, first of all, we need like that maximum power to be fast, but we also need the muscular endurance in addition to the cardiovascular endurance.
Yeah.
So, do you have any advice on the rep ranges for like the lunges and the calf raises, for example?
Well, I think again you need to have both because you're looking for two different capacities. So if you want to do more, it depends also on the athlete. If you're a really a sedentary one, you can just do 3 times 10s. But if you're like a really explosive two time two and type 2 X fibers, a typical sprinter, you should maybe do a little bit more of the resistance, the cardiovascular resistance, like higher reps to get to build stamina. But if you're
Okay.
more of the slimmer, you have good stamina, good endurance, you might want to emphasize more on the strength part, lower reps, higher weight. And if you want and if you're in the middle and you just need to build more muscle, you should probably be in between the 8 to 12, maybe 15 rep range. So, and the intensity depending on the intensity.
Right, so I'm definitely the guy you talked about, the slim or endurance type of guy. I never seem to be able to gain muscle, but my cardio is pretty decent. So for the strength thing, you're saying like 3 to 6 reps, something like that, or
Yeah,
cool.
I think for you, with some like for you, 3 sets of maybe 8 to 12 reps would be in the optimal rep range.
Okay, so that high. Okay, cool.
Yeah, if you want to build a little bit muscle and some hypertrophy, some muscle mass.
Right. Even for my calves and all that, you would go for muscle mass rather than like maximal strength.
Well, I think both. You should, if you're doing it twice a week, you should have maybe one with more sets, lower weight, higher intensity in terms of weight, and the other one should probably be, 3 to 4 sets and maybe 15, 20, 25 reps in
Wow,
the
that's
in.
high, man.
Yeah,
Okay,
that's really
okay,
high. And
okay.
I think you need both, to be honest.
Right. And what about when you get those pains? Beginners, I know you get shin splints. That's a very common injury.
Mhm.
Some people get like foot issues, like plantar fasciitis or whatever, like pain in their feet. And especially more for the overweight, I guess, there's knee and lower back pain. Uh, do you have,
Yeah.
other than taking it slowly and like being careful and listening to your body signals, is there any way you can do like speed up the recovery, or like what do you do with shin splints, for example?
Well, shin splints in the medical world is called medial tibial stress syndrome. So
Right.
what MTSS are is that it's actually the beginning of a stress fracture of your tibia, the bone in your calf.
Right.
So that's an early sign that it's getting irritated. It's probably being, on its way to progress to a fracture. So there's different ways, different things we can do. We know that loading is one of the things we want to do, but optimal loading, not exaggerating the loading. You would like to look that you get sufficient sleep and recovery, so your body is able to, recover. Number two, you want to eat better food. Biochemistry is one of the most underrated and most important part of the rehab phase. Your body needs a lot of macronutrients and micronutrients. So eat tons of vegetables, get your proteins, get sufficient with proteins. I would advise people to get somewhere in between 1.5 to 2.5 grams of protein per kilo. That's
Yeah, that's
really
pretty
high
high.
numbers. But
Hmm.
yeah, but there's a lot of research showing that for rehab, that's a really good effect. And one
Okay.
of the things that people who have medial tibial stress syndrome is that they develop something called low-grade systemic inflammation. So with time, having the little inflammation all the time, you need to look into your lifestyle factors, as I just mentioned. But when it comes to
Right.
the loading, do a lot of strength training. Try to stimulate your muscle on the anterior part of the calf. The tibialis anterior. Try to do
Right.
your leg raises with a bent knee and straight knee, so you can address the soleus muscle and you can address the gastrocnemius. So both of them have to get isolated in best way possible. Remember, when you run and you jump, you get 8 to 12 times your own body weight loaded into your calves. So you can just strength train it and make it even stronger. And of course, decrease how much you're jumping or running and try to make it slow, the inflammation grow as it should.
So you recommend also doing this tibial flex type of workout where you put like a elastic band or something and pull your toes towards yourself.
Exactly. Yeah, definitely.
All right.
Super good
Cool.
exercise. It's very helpful to strengthen the front side as well, anterior part of it.
Yeah. Okay. Excellent. Thank you. Right. Do you think it makes a difference? I mean,
If
sorry.
I can just mention one thing, just to mention one thing, you want to have a muscle balance on both sides of the joint, not just a
Yeah.
strong calf on the posterior part. You want the anterior part to be strong as well.
Makes sense. So, I mean, a lot of people, especially lately, I think, started to jump on jump rope mats. So, like, rather than jumping on a hard surface, people buy specific mats to put on top of the hard surface. And I also noticed during this last winter, the gyms were closed. I didn't have enough space at home to jump, so I went into the garage to jump. And if you jump a lot on a hard surface, would you say that is more of an injury risk, or is just the volume that makes it the problem?
I think you just mentioned it there. I think that it's all about the how your body adapts and the load you put through it.
Right.
Of course, total volume has a lot to say, and the frequency. If you're sedentary and you're overweight or you're weak in the muscles and you haven't done it for a while, you should load it gradually. And we have something called rate of perceived exertion we will use in strength training. So let's
Uh-huh.
say if you can do 5 minutes, start doing 3 minutes, and you should always have some reps in reserve. You should
Yeah.
never go full out in the beginning. You should be able to build up a capacity that makes you able to jump the minutes or the session you want, but you should gradually build it up and spend time. Remember, when you're jumping or running, you have your weight loading, and you have the load from the gravity load, and you have your body adapting, and you have the reaction forces. Your body will adapt. So instead of buying a lot of mats and things, maybe just jump for 2 minutes instead of 5 minutes, and
Yeah, I love it,
next
man.
time
Yeah.
gradually build it
So
up.
yeah, so don't always go to failure, huh?
No, and always
Yeah.
give your body time to adapt.
Excellent. Yeah, that's really good advice. A lot of people want to feel dead after a workout, but it's actually nice to
Mm,
have a little bit in reserve and you're on the way up when you leave the gym.
exactly.
Yeah. Okay.
Especially, especially because especially because it's weight-bearing muscles, weight-bearing joints. If you do a chest or back workout, you're able to go to failure without having any consequences. But when you
Yeah.
do roping or you do strength training of the legs, you feel it all the time because you're moving and you're walking on your legs.
Yeah. That's very interesting, man. Do you have any advice for the feet at all besides wearing good shoes? Like, is there, like, if your feet start to hurt or to prevent them to start to hurt, is there any strength training, stretching, mobility, or something that people should think about?
Well, I think instead of just doing stretches, we have from the skin to the bone, we have 4 layers of intrinsic muscle within our foot plantar part of the foot. So doing taking a napkin, taking off your shoes, and trying to bend napkin, stimulating the deep muscles of the foot, trying to try to put a pen between your feet and write your name and try to
Whoa.
switch between the toes.
Hmm.
Just try to stimulate the muscle, stimulate as much as possible. We're not used to it. We have socks, we have shoes all the time, and suddenly you're going to be jumping. Make sure the whole foot is strong, because stretches alone, just to stretch a muscle, is not optimal. You need to have
Right.
optimal loading.
Yeah.
Shortening, strengthening of the.
So, if anything, do that pen workout rather than stretching the foot, huh?
Yes, I would. Well, do both, but
Okay, okay.
I would recommend loading it instead of just stretching it.
All right, so let's make that a challenge. See if you or me or anyone out there can actually write their name using their feet. Sounds hard, man.
I would love to see that. I would love to see that.
All right, so we're running out of time, Finn-Tore. I mean, I could go on talking about this with you forever, but maybe we have to make a part 2. But this was super useful. I really appreciate it. And who knows, maybe if we get some comments or feedback on topics we should follow up on, we could, make a part 2 if people are into that. Yeah. And so anyways, this was super useful. I mean, I thought it was useful, so I'm sure some people out there will definitely think so too. I really appreciate you showing up. So make sure to check out the description of the video for all the places you can follow Finn-Tore. And yeah, always good to see you. Thank you so much.
Likewise. Thank you for your time. And thank you for the invitation.
Of course. All right. Take care.
Take care. Bye-bye.
Bye. Thanks for watching the video. If you have any feedback, comments, questions, or other topics you want us to cover, drop a line in the comment section. And please hit the like button to help spread the word about jumping rope. I'm Kjartan. This is Jump Rope Tips. Subscribe to the channel for more updates, and I'll see you in the next one.